Michelle. I was a CNA for about 15 years and an MHW for about 3 or 4. I worked on a psych unit, an ITU, which was the most intense. Had a situation with a patient that had gotten out of control, and he punched me in the side of the face and picked me up and threw me into a wall when I tried to go back and help the situation again. From that, I ended up with post-traumatic concussional syndrome. Due to the accident, I had a problem with expression and speech apraxia, trouble comprehending what I read, sometimes what I heard. As far as driving, I tended to always go to the left, so I was constantly having to, either I'd have to stay in that left-hand lane, because if I didn't, I'd be rearing into the other car. And it's very difficult when you don't realize where it's coming from and don't even really understand what it's coming from, because the doctor I was seeing would keep on telling me, you shouldn't be having a problem with your balance anymore. And that was the reaction. It wasn't, maybe there's another problem. It was always just, you shouldn't be having that problem anymore. The same with the balance. I would say I have a problem, like in the shower, I can't take a shower without losing balance. I can't put my head backwards without losing balance. And the same situation. He turned around and told me, you shouldn't be having that problem anymore. But didn't do anything to counteract the problem. Writing was difficult because I miss letters when I write. I would write so small that people couldn't understand what I was writing. Balance was get up in the morning and use the wall to make sure I didn't fall over, because especially first thing in the morning, the balance wasn't right after sleeping. It just didn't. I would wake in the middle of the night, my hands would go numb, made it difficult to just do the daily basics things. I had seen a doctor, neurologist, for about a year, actually 2. Went through cognitive speech with the rehab center, and actually ended up getting worse instead of better. Workman's comp nurse had suggested Dr. Beto to me, and within a very short span of time, my microscopia started getting much better. My speech was not an issue as much. Amazing to be able to go out in public and not feel like, can I stay here, and be able to get through a conversation, even with a family function, that I wasn't able to do. I went for a walkathon that I never would have tackled after the injury, because being with people around me, and especially on that side where I got hit, the noises would rapture. I couldn't stay within the people. It just would get me where I was so uncomfortable. I was thrilled with the fact that I could actually, I was always able to read when I was writing, but other people couldn't read what I wrote. My gait became much better within a couple of weeks of being here, and I was able to do those things due to the therapy that you had done with me. I found coming here, the people never made you feel that you were handicapped in any formal way. They always made you feel at home. Never felt like a hospital atmosphere, and which made it much more comfortable. I felt that I really didn't think it would work, to be honest. Certainly not as quickly as it did. I would see a lot of patients that a lot of their problems came from an initial injury that people didn't acknowledge, and other issues came into it because of it, because it wasn't addressed properly. It wasn't, they would send them to like a rehab, and the rehab wasn't what they really needed. And I really wish that they would take a stronger step to educate doctors on what else is out there, instead of just this is what we do, not this is what we can do, this is what I do, because this is where I am, and this is the field I'm in, and not step beyond that they might not be right in that particular thing.